Hello, everyone. Welcome back to another exciting episode here on Doctors Go Live. I'm Nina Sharil Khan, your host for today. And today we are going to be talking about something that's quite personal for me. It is beyond the label understanding autism. Now, let us know if you are tuning in. We've already got a couple of viewers Leela, Ng Pei Kwang, Nurul, Florence Ong. Welcome to the show. We hope you'll be able to get whatever you're looking for in this episode. And let us know where you're tuning in. And of course, what would you guys like to learn in today's episode beyond the label understanding autism? Now, if you share this video out, you get to take part in our Doctors Go Live quiz happening right at the end of the Q&A, where you get to win a neck pillow. That's what's happening today. So all this is happening on Doctors Go Live with me, Nina, and our special guest for today, Dr. Annie, who is a consultant pediatrician from Columbia Asia Hospital, Klang. Now, with autism, diagnoses are becoming increasingly prevalent. Understanding and support has never been more essential. Now, in today's episode of Doctors Go Live, we'll be talking to consultant pediatrician from Columbia Asia Hospital, Klang, Dr. Annie Liau, to unravel the complexities of autism beyond the label, where we get to explore early signs and crucial support avenues for children as well as their families. It is also April Autism Acceptance Month, so today we're going to find out all we can on how we too can do our part in uplifting the autism community. So if you know someone who this information would be very useful, or if you think this is such an important topic that's going to make a difference in the lives of your friends, their children, or anyone who has autism, please do share this video out. Tag it in your social media, tag your friends so that we can all learn and uplift the autism community. All right, now let's take a look at this video.
And bluebirds. She did.
Today, more and more children are diagnosed with autism. Yet, autism often gets misunderstood, buried under layers of misconceptions. I'm Dr. Annie Liau Fui Vun, Consultant Pediatrician from Columbia Asia Hospital, Klang. Join me in the next Doctors Go Live, where we will delve deep into understanding autism beyond its label, unraveling its early signs, and exploring useful support avenues for not just children, but their parents as well. Happening on Wednesday, 24th of April at 3 p.m. See you there.
All right, welcome back. You are watching Doctors Go Live with me, Nina Sharil Khan. And if you've just joined us today, we are going in deep in understanding autism beyond the label. So autism often gets misunderstood, buried under layers of misconceptions. So today, we're going to unravel the complexities of autism beyond the label, explore early signs and crucial support for children and their families. So with that, please welcome from Columbia Asia Hospital, Klang, Consultant Pediatrician, Dr. Annie Liau. Dr. Annie, thank you so much for joining us.
Thank you, Nina, for the kind introduction. It's my pleasure to be here.
Awesome. Okay, so also just to remind our viewers, right at the end of the show, we're going to have a quiz where you get to take part and win a neck pillow. All right, so if you have any questions, please feel free to write the questions in the comment and we'll get to it at the end of the episode, just before the quiz. All right, so first things first, Dr. Annie, could you share with us a little bit about yourself, how you got started in pediatrics, and why is it important that we talk about today's topic, which is autism?
Okay, thanks, Nina. I'm born in a small town in Tawau, Sabah, and the Sabahan. So after my SPM, I was very lucky. I got a scholarship to study medicine. Then initially, actually, after finish medical school, I planned to do adult medicine. However, after housemanship, I was sent to this MIRI in Sarawak, and I was sent to pediatric department. I have no intention of doing pediatric at that time. However, I have my pediatric head of department, Dr. Chia. Her passion in dealing with children and their family was just infectious, and she have infected me and brainwashed me. So that's the reason I took up pediatrics and become a pediatrician. And I think in 2008, I was in contact with a few close family members and friends, children who has autism. And I realized that whatever basic training I got from pediatrics is not sufficient for me to help them in a very practical manner. And that's how I started my journey of learning more about autism. And this is my special interest.
I see. So your special interest is actually autism. Wonderful, doc. Yeah, kind of thing. Okay. Also, I believe April is Autism Awareness Month, right, doc?
Yes.
Sorry, Autism Acceptance Month.
Assessment one.
Yeah,
Correct.
and before it was awareness. Why did it change from Autism Awareness to Autism Acceptance Month? Do you know?
Yes, I mean, we talked about a lot about autism awareness before, because we want to make the public to be aware of this condition. And however, now we feel that awareness alone is actually not enough. We need to have the awareness need to lead to actions that bring about impact in this family's life. So this is why I think now we call it the Autism Acceptance Month. We want these individuals to be accepted as part of the community, and that we should accept them for who they are.
Right, and not try and change them to be something that they're not. Because I do think as Asian parents, we have a lot of expectations, right?
Right.
Can I think? All right. So, Doc, so speaking of this, why is it important that we talk about today's topic?
Yeah, actually, autism comes with, there's a lot of stigma and misconceptions about this label. So I think it's very important for us to dispel all the myths, the misconceptions, and the stigma that has been associated with autism. And then we need to have understand what autism is about in order to really help this autistic community. So this is why this topic is extremely important today. And also the prevalence of autism, according to the Center of Disease Control from the United States, the latest one I think is in 2020, it shows that it's about 1 in 36 children has autism.
In the
This
world.
is, yeah, this is like, I mean, we have very scanty data in Malaysia, but even we go with very conservative statistic all over the world, is about 1%, which is 1 in every 100. What this means is that it's not surprising that if you have family members or relatives or colleagues' children or your neighbor's grandchildren who has autism, or even your Grab driver's daughter. So I think this is something that there's a significant proportion of individuals who are in the autism spectrum, and it's very important for us to understand them and support them.
Okay. Okay, got it, Doc. So it's very important to understand and support them. If there is one thing you want the audience to take home from this episode, what would it be?
The most important label for this individual is their first name.
Okay. And nothing else.
I mean, autism doesn't define them. So we have to look at them as is, because autism is just a small part of who they are. Because I think one common mistakes we all of us make is we always, when they have there's something that is unexpected that they display, we will automatically say this is because of his or her autism. Sometimes it is, or sometimes it's not,
Right.
because they also have the same needs like all of us do. They need love. They need a good shelter. They need good diet, safety, sleep. They have special interests, just like all of us. Just that the special interest might not be the same like most people. They have their sensory preferences, which we all do, right? We all have our special pillows, our special bolster, and sometimes we can't sleep and we move to another new place with
Right.
different sleeping arrangement. It's just that the way they sense the world are different from us. So this
Okay.
is very important. We need to understand them in order to
Okay.
help them.
All right. So basically, the most important label is their first name. That's it. So, and it's very important to do so, because otherwise we're putting them in a box, and that doesn't help us or them either, right? Kind of thing. Wonderful. So speaking of what you mentioned earlier, that if we could have the slides, that autism is, the data is, there's more and more kids having autism. I can attest, because I think when I was growing up, there was no such thing as autism. And suddenly I had a niece, she's now 23, she has autism. So she was my first exposure. And now it seems like, at least I have 5 friends with kids with autism. So what's the data like, Doc? Can you share with us?
Okay, can we show the prevalence data slide?
Yes.
Okay, this is a Center of Disease Control from United States data. The latest one, as you can see, there seems to be an alarming increase in the prevalence. In 2012, it was 1 in 69. And then the latest one is in 2020, is 1 in 36. So this is across 11 sites in United States. They're collecting data from all the 8-year-old children. So, okay, can we show the next slide on Malaysian data? Okay, unfortunately in Malaysia, our data are kind of limited. So there is an unpublished data in 2005, which showed 1 in 625 children between 18 and 26 months, which is about 1.6 in 1,000 children. So subsequent years, I think the latest data we got is in 2021, where we have 589 children of less than 18-year-old, which is about 5% increment from the year before in 2020. However, this is slightly underestimation, because for example, OKU card application is at the moment is not compulsory. So even if we look at the data from OKU registration, we are not actually capturing all the individuals with autism. So, but this is what we have. So as I mentioned before, the very conservative statistic all over the world is about 1%, which is 1 in 100.
Okay, got it. 1 in 100. Okay, got it. So, Doc, looking at the data, why do you think there's an increase in numbers?
Yes, there's a lot of debates about it, whether there's an actual increase in the prevalence. However, I think I can quote one of the leading experts in autism research, who is Dr. Ami Klein, the director of Marcus Autism Center in Atlanta. He has done more than 2 decades of research in young children with autism. He was asked this same question in a very recent interview, and he feels that the reason that is that, number one, we are getting better in picking up and diagnosing these children. That's reason number one. And also number two, the public and the parents are more aware of this condition. And parents nowadays, once they see that the children, the speech development or the social development are not on track, they will seek pediatricians assessment very quickly. And number three, also the diagnostic criteria for autism, the latest one is in 2013. We actually have revised it, and that also includes those autistic individuals who are on the milder spectrum. So we are also picking up those on the milder spectrum. So these are the reasons the expert feels that explain this increase in the prevalence of autism, because we are able to collect more data now.
Okay, got it. So it's increase in diagnosis, as well as more people being aware. there is
Correct.
such a condition, and intervening and diagnosing it earlier lah. Yeah.
Correct.
Okay, got it. So let's take a look at the next slide. So, Doc, when we talk about children being diagnosed with autism, what exactly is autism? What does it entail? And are there different varying degrees of it? Because you mentioned earlier there's a milder spectrum, there's a whatnot. So, if you could share with us, Doc, what exactly is autism?
Yes. Okay. So in medical terms, we say autism is a neurodevelopmental condition. So neuro means something to do with the brain and the nerve system, right? Development, I mean, in the children context, every normal, typically developing children, they will go through a series of developmental milestones where they will achieve certain skills at a specific stage in their age. So this is called neurodevelopment because in autistic children, they are born with this brain which is wired differently, and this has an impact whereby they will have a atypical developmental trajectory compared to typical developing children. And the major difficulties is in the socialization and the communication domain of the development. And
Okay.
the second important domain that is affected is that we also observe what we call restricted repetitive behavior in these children. So for this restricted repetitive behavior, that includes unusual repetitive body movements, unusual repetitive use of language, very rigid type of thinking, and very inflexible to changes. Sometimes they have very narrow and very fixated, intense interest in something that is unusual compared to their peers. And lastly, some of them also have what we call a sensory problem, whereby they can be hypersensitive or hyposensitive to certain environmental stimulus. And don't worry about this because we are going to explore deeper in the subsequent slides and the videos.
Awesome. So, shall we go to the next slide then?
Oh yeah, and you mentioned about the spectrum. Yes, and this
Yes.
condition has a very wide spectrum.
Okay.
So someone who has this diagnosis of autism, it could be a professor of animal science, for example, Temple Grandin, who is a very famous autistic advocate. She's currently a professor in animal science teaching in University of Colorado in the USA, and very intelligent. However, she's still having some difficulty with social
So,
communication. Or
nice.
at the other end of the spectrum, it could be an adult who is non-verbal. Non-verbal meaning not
Not
able to speak any meaningful language, not able to take care of himself, and fully dependent on another caretaker to take care of his daily living. So these are the two extreme spectrum. However,
nice.
there are many individuals who lies in between these two extremes.
Wow.
So the spectrum is very wide.
Mm. And does I suppose we'll cover this later. Um, where you are in the spectrum, is it dependent on certain things? Maybe intervention? Does it help?
Oh, definitely. Intervention. That's why intervention is very important, especially the earlier the better, because the earlier we do interventions, especially during what we call a lot of people talk about the golden period of development, which is the first 5 years. This is because the first 5 years, the brain development is at its greatest, whereby intervention will have a very huge effect with a very favorable outcome. It doesn't mean after 5 or 6 years there's no hope. No, it will still have a positive effect on this child to optimize their ability. It's just that the outcome will be much more is greater if it's done earlier.
I
And
see.
so when we do a diagnosis for doctors, like pediatrician or psychiatrist or even clinical psychologist, we have to say that whether this is a level 1, 2, or 3, just for the parents to know. So what we mean by level 1, 2, 3, level 1 means needs support, Level 2 means need substantial support. And level 3 means need very substantial support. In other words, it can translate to mild, moderate, and severe.
Okay, got it.
So parents maybe need to aware of this, because I think when you do reading, you always come across this terminology. Is it level 1, 2, or 3?
Okay, so I guess that's why, because it could be totally varying, and depending on the intervention, early or late, you get so many different results. It's really even more important not to label. It's beyond the label, right? Because each case is unique, each child is unique, right?
And of course, it's important that we give a diagnostic label.
Yes.
Because this will help initiate the intervention.
Mm-hmm.
Yes, because we have to differentiate autism from, there are also many other different types of developmental problems other than autism.
Mm-hmm.
There are some kids, they are just a speech delay problem. Some probably
Right.
having a motor delay problem. And so it's important, diagnosis is important, so that we know which developmental problem that they belong
So that we
to.
can tackle it and
Because
get
the
this.
intervention has to be individualized.
Yes. Okay, got it. One more question before we go to the different types of autism. How does somebody get autism? Because some families, Malay families, they might think they did something wrong, they ate something wrong, or maybe I gave birth when I'm much older. So how does it happen? Is there a cause for it?
Well, that's a good question. It's also a very complex question. The
Mm-hmm.
cause of autism actually is a predominantly genetic condition. However, it's complex, it's not so straightforward. Scientists have been studying for years and identify hundreds, more than 500 genes which has been implicated in causing autism. However,
Mm-hmm.
it is not straightforward like some genetic condition like Down syndrome, whereby there's a clear-cut chromosomal abnormality, whereby the chromosome 21, there's an extra
Yeah.
chromosome 21. And we can do blood tests and easily diagnose Down syndrome. However, autism is not like that, because it involves hundreds and hundreds of genes that has been
Mm-hmm.
implicated. And just because an individual have this gene doesn't necessarily means he or she will have autism later on. There is
Right.
also a component of the interaction of the gene with something in the environment. So it's a genetic made up with interaction with the environment. However, the genetic component has a stronger weight. So
Okay.
so there are some environmental factors that scientists have identified that may increase the risk of autism. So, but understand, risk does not equal cause. Okay.
Result.
So,
Yeah.
what are the risks that have been associated with increased risk of autism? That includes the premature birth, like baby born prematurely, especially those less than 33 weeks of gestation.
Okay.
Babies who are born with very low birth weight, less than 1.5 kilogram. Okay.
Okay.
Or during, there is some events around the baby's birth that cause reduced oxygen delivery to the brain. Okay.
Right.
That is
Okay.
also a risk factor. Another one, if mother during pregnancy has some infections, that also has been shown may increase the risk of autism in the baby as well.
I
Okay.
see.
Some other factors also include advanced parental age.
Ah,
So yes, if the father's age more than 45-year-old, mother's age beyond 40-year-old also has been shown to be a risk factor as well.
I
And
see.
of
Okay.
course, family history, because as
Mm.
I mentioned, there's a strong genetic basis to it. So if we will ask the history, father's side, mother's side, is there any relative that has autism or suspected autism or any developmental problem. So because to some degree, this is there's some degree of heritability as well.
Okay, got it. Now, I'm just going to stop for a moment there. If you have any questions whatsoever, feel free to put it in the comment, and then we're going to address it at the end of my interview with Dr. Annie. All right, let's go to the next slide. So, could you share with us what this slide is about, yeah, Doc?
Yes, I would like to show this slide just to emphasize that for autism, the key disturbance is the social domain. Yeah. So just to explain, so actually what is important in the early social development of a baby, right? So as you can see in the photo in the left hand side, when a newborn baby are born, they are actually there's no need to teach. Yeah. So God or nature made it in such a way baby will are predisposed to orient more to the caretaker. So they will prefer to look at a human face rather than object. I think this is something to do with increasing the survival of this baby. Imagine the baby, if they are left alone, this baby is not going to survive. They need a caretaker, right? So what happened in autism, research have shown that they have done studies in children who later on to have autism. These babies, the predisposition to orient to people and to engage with people are either absent or impaired or reduced. So this is the key impairment noticed in this very early development of the young babies. So can we go to the next slide?
Can. Hang on. Okay.
Okay, before we play this, so I just want to mention, so there are 5 very key concepts that we need to understand, which is very crucial in the social development of young babies and children. Number 1 is eye contact, right? So eye contact is essential when we interact with people. Number 2 is what we call joint attention, okay? Number 3 is what we call social referencing. Number 4 is theory of mind. And then lastly is what we call a central coherence theory. Don't worry about this now because we are going to play some video and this will help us understand better.
Okay, awesome.
Wait, this study, just a background. So this is a very interesting study done by Dr. Amy Klein and Dr. Warren Jones. Okay, Dr. Amy Klein is from Marcus Autism Center. Dr. Warren Jones is a professor Emory University of Medicine. So they published this in 2002. So what happened? They actually there are 2 groups of adult males, 15 adult males who are autistic, and another 15 who is what we call neurotypical. Neurotypical means they are not autistic. Age and sex and IQ matched cohort. So and then they will play this video clip and they put an eye tracking device on them to see where their eyes are fixating. So the reason this is an interesting movie is called Who's Afraid of Virginia Woolf? Again, it's starred by Elizabeth Taylor, Richard Burton, and also Sandy Dennis and Josh Segal. So the reason Dr. Amy chose this movie because it's a very socially complex movie. Yeah. So now we can play this movie now.
All right, let's take a look at the video.
Angrily smashes a bottle, and his dinner guests, Sandy Dennis and George Siegel, react in horror. Dr. Amy Klein, who designed the experiment, analyzes the eye responses frame by frame. Most viewers look into the eyes of the guests to see their emotion. Those with autism look away from the eyes, at the mouths.
Are they avoiding the emotion or they're just not detecting it?
The eye does not seem to mean much to them. Even when they focus on the eye, they appear not to get too much information from it.
The research is not limited to the adult autistic brain. The scientists are using eye-tracking devices on children like 16-month-old Tyler Klang, who does not have autism.
Okay.
All right.
So, Nina, so what do you think you have learned from watching this video clip?
Basically, I think it's the eye contact thing, right?
Yes.
The difference between kids with autism or those with autism and with not. They tend
Yes.
not to have eye contact, whereas normal people will definitely look at you.
Yes. So
Mm.
this is quite an interesting finding. These are adults who has normal intelligence who are autistic. So normal adult will focus on the eye area of the actors and the actresses. This is how we understand others people emotions. Yeah. But you
Yes.
see, these autistic adults, they are looking elsewhere, anywhere else except on the eyes. So you can imagine how will that impact on their day-to-day social interaction with other people. They will be missing all the important non-verbal social cues in social interactions. So
Okay.
that is why autistic people they often misunderstand other people's feelings and intention, and they also get misunderstood because
Mm.
they are not
They're
able to adjust their behavior and reactions according to the social context. They are
I see.
missing it out. They are missing all the important clues.
Okay, got
Yeah.
it.
Okay.
Okay.
Now,
All right.
can we go to the next slide?
Okay.
Okay. So the same group of researchers, I think 6 years later, in 2008, they published it in a journal. Now, but this time they are doing this study on 2-year-old toddlers. Yeah. So the toddler, they are 15. So you can see 3 columns here. The
Mm-hmm.
left one is autistic toddlers, 2-year-old. The middle one is normal developing toddlers. And the one on the far right is toddlers who are developmentally delayed, but they are not autistic. Okay.
Okay.
They put eye tracking device on them. Then there's this approaching lady who is like a caretaker figure who is talking and interacting with them, and they will track where these children are fixating their eyes on. Yeah. So basically, what this study has found out is that, I'm sorry, I think you might not see very clearly here. There's some white marking here indicating where they're looking at. So
Mm-hmm.
for the middle and the normal developing as well as the developmental delay but not autistic group, they look mainly in the eye region,
Mm-hmm.
followed the mouth, followed by the body, and
Mm-hmm.
then lastly, object, right?
Mm-hmm.
However, in children with autism, there is a very obvious difference whereby they focus mainly in the mouth. So
Mm-hmm.
mouth get their fixation,
Mm-hmm.
followed by body, object, and the eyes is the part that they least fixated on.
Wow. Okay.
I find this
Interesting.
study very interesting because, of course, we know, all of us know all the autistic children or adult very poor eye contact, no eye contact, but this study has like objectively shown this finding. So again, it shows us the differences of, eye contact is one of the obvious signs that we look for in autistic individuals. Yeah. Okay. Of
Okay.
course, there's some other important conclusion from this study, but I think I have no time to
Yeah.
discuss about. The other
No
thing
worries.
they have found out is that the least they fixate on the eyes also correlates with a higher social disability score in a standardized test called the ADOS-2, which is Autism Diagnostic Observation Schedule. Okay,
I
so
see.
yeah. Anyway, we can go on to the next one. Yeah.
Okay.
So we cover eye contact, which is one of the crucial element in social interaction. The second one is what we call joint attention. What is joint attention? Joint
Mm-hmm.
attention means two persons sharing interest on one object. Yeah? I give you an example. For example, it can be initiated. Usually, I do this in clinic. What I do is I will point my finger to maybe a teddy bear across the room. I say, "Look, teddy bear." So then I will see whether the child follow where I look at, where the teddy bear, will the child follow my point and look at the teddy bear? Okay. So a normal response should be the child should be able to follow my gaze and my point, look at the teddy bear, and usually they will also look back at me. So there
Mm.
is a mutual exchange of gaze between the teddy bear and me. This is what we call joint attention, the child responding to it. Or
Okay.
whether the child actually can initiate joint attention as well. For example, the child probably got a new teddy bear, but he wants to show it to me. He will come near me. He will actually hold the teddy bear up, and he will look at me, and then he will look at the teddy bear. It's something like, look at my teddy bear to get my attention. So this is what we call joint attention. To make you understand better, we are going to play the next video.
All right, let's take a look at the video.
Sigmund measured joint attention in the responses of 3 different groups of children to various stimuli. Normal babies, children with Down syndrome, and children with autism.
Very nice.
Children with autism don't pay much attention to the attention patterns of other people. They don't really look at where other people are looking. It doesn't seem to occur to them that other people have points of view that can be shared. And so they seem very isolated in that sense.
In a similar experiment, Sigmund studied the reactions of children to someone else's pain. It takes a normal baby only a few seconds to realize that someone is hurt. Children with Down syndrome respond readily to the emotions of others. But someone else's distress doesn't seem to touch a child with autism. It's as though emotions are a foreign language he can't interpret. Reacting to other people's fear is a basic survival instinct.
Amazing.
They tell us they have feelings. Their parents tell us they have feelings. This is another place in which I think our current research shows that the previous understanding of autism was wrong. Their heart rate responses are no different from those of mentally retarded children who are at the same developmental level. So I think that they very much have feelings, but they have a very hard time explaining these feelings to themselves or expressing them in ways that other people can understand.
That's amazing. That's an amazing video. I love the child with, with the Down syndrome.
So brave.
Yeah.
Yeah.
So brave.
It was Dr. Marian Sigmund. Unfortunately, she passed away in 2012 at the age of 70, but her research is very nicely done. So she was absolutely right. We used to think that one of the misconceptions is autistic people have no feelings, no emotion. That is very wrong. They do have feelings, they do have emotions. However, they have a condition, what we call alexithymia. Don't bother about medical term. What it means is that they have difficulty recognizing, expressing, and describing their feelings and emotions to others. So at the same time, they also have difficulty recognizing, understanding, and emotions and feelings of other people as well. So that makes social interaction very challenging for them. Yeah, as you can see from the video, if even the child with Down syndrome, whereby his social development is intact, he reacts appropriately with whatever situation that is kind of engineered. Yeah, whereas the autistic child, he's not aware of it could be danger, It could be a very frightening situation, but he's not picking all these cues around him. Okay, now I think we can move on to the next one.
Got it. Okay. This one?
Okay, yeah, it's social referencing, a very important part of social development, whereby autistic children might show an absence or the lack of it. So we can play the video now.
All right.
In this study, babies between 9 and 12 months are brought into the lab and placed on a large plexiglass top table. Half of the table has a checkerboard pattern just underneath the surface, but halfway across is a visual cliff, which the baby can tell drops off steeply. The plexiglass top continues, so it's perfectly fine to proceed. But the baby isn't so sure, and this is a big drop for a baby just starting to crawl. She wants to get across to get the toy, but she's cautious and looks to the opposite end of the table where her mother is. The parent is instructed to smile or make a fear face.
If the mother is posing a fear face, the baby typically does not cross this stair-step downward, this modified visual cliff or visual step. On the other hand, if the mother poses a smile or somehow poses a nonverbal communication that is not prohibitive but encouraging, the child is much more likely to cross over to her. This particular study demonstrates the role of nonverbal communication in determining the child's behavior in uncertain contexts. A baby will, when they encounter something ambiguous, something uncertain, will typically look to the significant other, the mother, the father, a grandparent, the caregiver, in order to figure out what to do. So by 11 to 12 months of age, the baby is already doing what all of us do when something unusual happens. We look around to figure out how other people are reacting.
Yeah, this is a very interesting study by Professor Joseph Campbell from University of California. So as you can see, when we are facing uncertain situation, unexpected situation, even babies or toddler very young age, they will look around them to look for non-verbal cues, like how should I respond to this? So imagine in autistic children where they have this lack in this orientation to observe people. So they will be missing out all these important cues. Yeah. So that definitely have a huge impact in their day-to-day social functioning. Okay. Now we can move on to the next one.
Sally
Okay.
Ann.
So another important concept to understand autistic people is that there is a weak theory of mind in them. Theory of mind means the ability to understand others' ideas and points of view. So this is very important because it helps us predict what others are going to say or do during a social interactions. Yeah. And this has been proposed by Professor Uta Frith and Dr. Siren Baring-Cohen. This is one of the impairment that explain the social communication difficulties in autistic individuals. Yeah, we can play this video now.
All right.
The classic test for mind reading is called the Sally Ann. It's a test that normal kids are expected to pass when they're 5 years old.
Who'd like to go next? Right, okay, this is Sally, and this is Anne. Which one's Sally? This one. Well done, right. And Sally has got a basket. And Anne has got a box with nothing in it. And Sally has got a marble. And Sally puts her marble into her basket to keep it safe while she goes outside to play. But while Sally's outside, naughty Anne moves the marble from Sally's basket into her box. Naughty Anne. So where's the marble now?
Box.
Good. Where did Sally put the marble in the beginning?
Basket.
In the basket. Well done. So when Sally comes back from playtime, where will she look for her marble?
In the box.
In the box.
Robert should have said the basket, because that is where Sally, in her ignorance, would have thought it was. He hasn't mind-read the situation from her point of view. What is it about the autistic brain, which means that children like Robert may never be able to mind-read like the rest of us?
If you find that yourself, you fail this test, doesn't mean you are autistic. Okay, so for this study, there are 3 groups of children they tested on: the normal, developing, the autistic, and the Down syndrome without autism. So actually, the only 20% of the kids passed this test. So yeah, but a lot of them have weak theory of mind, but that is not all. Some actually can still pass. Okay, it's one of the features we look for. Sometimes I do this test in my clinic as well. And however, for normal kids as well, actually the passing, 85% of them pass for normal developing children, and Down syndrome, 86%. Okay, again, it's not like an absolute, you fail means you're autistic kind of thing, but it gives us some indication of how strong is your theory of mind. Generally speaking, children of 5 years and above should have theory of mind, means they should pass this test. Yeah. Okay.
Okay. Got it. Next slide. Okay.
Okay. Then this is another very important concept to understand, especially we see that a lot in probably the milder spectrum as well, but it's across the spectrum. Is what we call central coherence. Central coherence is okay when we have a lot of information that we are looking at. Maybe it's like a picture. We will see the whole first before we see the parts, yeah. But a lot of individuals with autism, they do it the other way around. They will actually fixated on the tiny little parts or the details before looking at the whole picture. So this actually can cause a lot of challenges in the day-to-day routine, even in school and in social context. Because I can give you an example. So I use this picture because I think this famous story, the blind touching the elephant, right? Because imagine if one man who is blinded, if you are the one touching the trunk, you will say it's a snake. The one touching the tail will say this is a rope. The one touching the body will say it's a wall. Yeah. You are not looking at the whole picture. It's actually an elephant. But if you are just fixating on one part, you just mix the whole picture. You are not decipher the whole picture accurately. So this is what happened. Sometimes I use picture to assess the children with autism who are verbal. For example, one of the photo I have is a photo of a few kids playing volleyball in a field, and then at the corner of that field, there's I believe there are few chairs, and there's a few adults sitting there watching the game. So I will tell the kid, can you tell me what do you see from these photographs? Yeah, I think most normal developing children usually say, oh yeah, these kids are playing ball, in the field. However, I have autistic children who actually, they will focus on the chair and they will start talking to me. The guy is sitting at the chair there, So they are not telling me, they are not interpreting the photo as a whole, but they are just fixating on certain part of it, just to give you an example. Okay. Go on to the next one.
Okay.
So I think after all these videos, I hope all of you have a deeper understanding why social communication is the main challenges in autistic people. Yeah. Okay, now we go next to the next part, which is what we call restricted repetitive behavior. In short, we call it RRBs, yeah? So there are 4 components to it. The first part is what we call stereotypic behavior. So these are photos of my actual patients, yeah? So it can be very repetitive kind of actions. For example, the photo on the left, one of the kids, he's almost 5. He wasn't interested in all the toys I display in my clinic, but he was spending a lot of time meticulously arranging the color pencils in a specific, making sure they are at a specific spacing between them. He was doing it repeatedly in the clinic. I mean, me and my nurse tried to engage him in other toys, but we failed terribly. He was very interested in doing that. So the other right hand side is another kid I saw in a government hospital. Again, he was meticulously lining up the blocks. I mean, of course, normal children can do that as well. However, the difference is that when we try to, the boy on the left, the mom actually warned me, doctor, you try not to disturb the arrangement, he may get upset. Yeah, so this is the difference. If some children do that as well, normal developing children, but it's how they do it and whether they get upset when we actually change or disrupt the arrangement. Usually they get upset. They just want things to be in a specific manner. Yeah. Okay, this is an example. Next one. The second one is what we call ritualistic behavior or insistent of sameness. So one characteristic is they have difficulty adjusting to even the slightest changes in routines or in activities. One common things I encounter in my patients are, as you see in the photo on the illustration on the left hand side, is when the parents are driving, usually they drive this way back home from school. One day traffic jam, the father changed the route. The child will be very upset because there is a change in the usual route. He just cannot accept it. Another scenario I came across is going to school ritual. Usually this kid, right, when he go to school, everyone has to follow a chronological event. Yeah. How he get out of the car, who opened the door, who greeted him at the entrance of the school. It has to be in a specific sequence. So one day the sequence was macam terbalik or reverse. Meltdown, he had a meltdown. So all adults have to go stand, and
Reenact.
yes. So I think it's something familiar to parents or family who has autistic children. It can be any kind of routine. It can be bedtime routine, morning routine, going to school routine. When there is changes, unexpected changes, they can't handle it very well. So there's some rigidity in it. Yeah.
Yes.
Next one.
Okay, hold on. Okay.
Okay, so there's this third feature in under the restricted repetitive behavior. We say is a restricted fixated interest. So the way medically it's like there's a negative connotation to it, yeah, because usually this kind of special interest is a little bit is unusual compared to the same age peers. I have children who are interested in marine animals. He's very minimally verbal 5-year-old. However, every time he comes to see me, he bring a book of marine animals. He can actually recite all the scientific names. But in terms of functional communication, he's not able to communicate yet. But he can recite all these. There are children who are very interested in road signs, the car plate numbers, traffic lights, this kind of interest. I have a little girl who is very fixated on straw. Every time she comes to clinic, she will bring around a straw. However, with intervention, she improved and she is able to have other interests and she no longer take the straw everywhere she goes. Yeah. So now this is symbol grounding, just an example. I think a lot of time we actually can capitalize and utilize their special interest to make it into something meaningful. Yeah. So this is what I always tell parents. Actually, it's a good thing that your child has special interest in something because this is something we can utilize and capitalize on. For example, Temple Grandin, which I mentioned earlier, she has speech delay, a lot of behavioral and sensory problems. You can watch her movie. This is I highly recommend this movie.
It's
It
really
has
good.
won many awards, and I've watched it a few times. And this is based on her biography entitled Emergence Label Autistic. I'm not going to tell you the details, so I don't want to be spoiler, yeah? So what happened to Temple is that one holiday she went to her aunt's farm, yeah, to spend her holiday there. So her aunt has cows and horses, and this is when she developed this very deep, intense interest in animals. And she loved animals and she loved spending time with cows and horses. And when she graduated from her high school, she wasn't sure what she wanted to study. And very lucky for her, she has a very understanding and supportive teacher, Mr. Carlock. So she asked Mr. Carlock, I don't know what I want to do. Mr. Carlock said, what do you like? She said, I love animals. Is there an occupation about animals? Then Mr. Carlock said, yes. How about you do animal husbandry? So that's how she did. She did animal husbandry. She's now 60 plus year old. In those days and age, animal husbandry is dominated by males. So imagine a girl like her. I mean, she encountered many difficulties. You can watch the movie. But she's now a very famous animal scientist. She have designed, as you can see, this is her blueprint of her cattle handling facilities who handles cows in a very humane way. I think more than half in the US, they are using her design. She's also a very active autism advocate as well. She has written many books other than her biography, including Thinking in Pictures and Animals in Translation as well. This is another book that she has written. And so the point I want to get across is so-called special interest is not always bad. It could be something that we can capitalize on these children.
Yeah. I think a lot of them have special gifts. I think it's actually an amazing thing for the parents to be able to discover that and to hone them so that they can really be the best that they can be in the world within that specific skills and gifts that they have.
Okay, Nina, yes, but again, probably it is a misconception that all autistic kids will be some sort of genius. I think that's a misconception.
There's
However,
only a certain kind,
yeah,
right?
maybe around 10% that will have some sort of exceptional abilities. However, I think all autistic children, just like us, all of us, we have our strengths, we have our weaknesses. So I think we should focus more on what they can do rather than what they cannot do, and we should optimize on their strength. Yeah. Yes.
Definitely. Okay.
I think,
so, okay. Shall we go to the next slide then?
Yeah, we'll go to the next slide.
Just before we go to the next slide, Jessie Liu is saying that there's another documentary called Love Across the Spectrum is also very interesting. So that's something that you guys can get information on. Yeah. All right. This one, Doc.
Okay. So under the restricted repetitive behavior, this is the fourth component, which is sensory differences. So we have here, you can see there are 7 senses: what we see, what we smell, what we hear, what we taste, our sense of touch, balance, and also body awareness. Yeah. So they can be hypersensitive or hyposensitive to all these sensory stimuli. Yeah? One common one will be the hearing. A lot of children, suddenly they will be covering their ears. They cannot tahan certain kind of sounds, even though this sound might not be disturbing to us. To use table grinding as an example, for her, the school bell ringing is like it's like a drill going into her ears. It's very painful. But of course, different autistic individuals will have a different experience, even with the same kind of stimuli. Yeah. Okay. So this is one of the differences in autistic individuals. Yeah.
Okay. Got
it.
it.
I think we can go to the next. So I think this video will show will help you understand their sensory differences.
Okay, so we can have
the video. Yeah.
We're sorry. This train is diverted.
Sorry.
I'm autistic, and the fear of unexpected changes can make leaving the house impossible.
Okay, it's just an example that sometimes going out to public places, it can be very overwhelming for autistic individuals due to their sensory, either hypersensitivity. Yeah. Okay.
Okay, got it. Okay, so now we kind of, how do we know, now that we know what autism is, how do we know if our children has autism? Because I recently heard that somebody only found out the child has autism at 7 years old, which I think is quite lambat lah. So what are some common early signs or symptoms that parents should be aware of?
Okay. Actually, there's a lot of signs and symptoms that we can observe from very early age. So I have actually summarized it into a mnemonics. I use a lot of mnemonics back to my student days. Yeah. So I hope this will help educators or parents or even young doctors to remember. I call it the 9-knot spiral mnemonic. Okay. So there are 2 S's here, which is not. Okay, one misconception I need to clarify here. A lot of parents think that is a yes or no type of situation, no eye contact. So sometimes when I told the parents, I think your child has autism, then they say cannot be, he has eye contact. It's not an all of none kind of situation here. Sorry, even though I put them not, but actually you can read I written a blog post on it. Is no or lacking. Yeah. So it's not just absent, it's also absent or lacking. Yeah. We also look at the quantity and the quality of it. So maybe I should change it to no and lacking. But anyway, so not speaking, very common, speech delay, not smiling, right? So baby actually will have responsive smile. When you smile at the baby as young as 4 to 6 weeks old, they will smile back at you. So if say by 3 months old, you notice you smile at baby or you interact with the baby not smiling back, is something of concern here. And then P, there are 2 P's here, point, not pointing. This is one of the very frequently observed symptoms here. By 14 months old, if your child is not pointing with finger to request for things or to show their interest in something, this is very alarming. Okay, usually babies, some can do that as early as 9-10 months old. Even though there's no language yet, but they saw something interesting, they will be like, they will point. Yeah. Okay. The other P is not progressing. So what I mean here is regressing. Regressing means we see this in some children, autistic children, they were developing normally, having a few meaningful words. For example, eye contact is okay. They have interaction with the caregiver. However, somewhere between maybe 1 to 2-year-old, suddenly what they used to do disappear. It's like they're getting backwards. They lost the acquired skills. We see that in a proportion of autistic in the children. Yeah. So this is what we call regression. Okay. So this is also very alarming. Sometimes we have to do a very detailed evaluation because some cases we may need to do some other types of investigations as well. Okay. So now next one is I. I for imitation. By 18 months old, if your child is not copying what you are doing or what you are saying, this is a red flag as well. Because by 18 months old, usually they're very kepochi one, no? They see you sweeping the floor, they will try to grab something and try to sweep the floor, try to wipe the table. They will imitate your actions. Yeah. And next one is R. R for responding, not responding to name calling. Very common complaint by parents. And in clinic, I usually do that also. I will call the child's name. And a lot of times for autistic children, you call 5 times, 10 times, no response, or maybe after 5, 6 times only he will turn, or very inconsistent response to the name calling. Yeah. And parents a lot of times tell me, I actually suspect whether my child is deaf. Yeah. Okay. So next one is A. There are 2 A's here. Not afraid of stranger, meaning typical children, they will have developed stranger anxiety, usually around 9 months of age. If a lot of autistic children, they actually don't have absent or very lacking, is like, I have kids who first time see me, they will come and sit on my lap. And the parents also reported that it's like he's okay with stranger, he's friendly even with stranger. So a lot of time we feel that we think autistic children means they doesn't want to socialize, they don't want to interact. But there's another spectrum where, because they don't understand social boundaries, so they have this lack of stranger anxiety, which is also a common symptoms. Yeah. And the next one is not appropriate. Not appropriate, this will refer to the RRBs, which we discussed about just now, the restricted repetitive behavior, like not inappropriate response to sensory stimulus, inappropriate way of communication, yeah, inappropriate way of playing with toys. A lot of time there is a lack or absence of pretend or imaginative play as well in these children. Yeah. And inappropriate special interest, which we discussed. Yeah. Inappropriate adjustment to changes in routine. Yeah. Okay. So lastly is L is not looking, which is the first thing we discussed, which is the eye contact. Okay.
Okay, got it. So, Doc, now that we know the red flags, how could you walk us through a diagnostic process? How does it
I'm
work?
going to do overview. Okay, so so firstly, doctors will do a very detailed history taking. You have to bear with us because we are going to ask a very detailed meticulous history from pregnancy, the family history, the child had any problem before, how is the birth like, is there, because we want to identify risk factor as we discussed before, is there any untoward events during the delivery, how was the mother's health during pregnancy, was there any problem, is there any family member who has autism or other developmental delay. And also we will ask about the developmental history from birth until now, how is the development in the all areas. And then that will be followed by physical examination, because as a doctors, pediatrician, we also want to look for, because autism can also occur in some chromosome genetic condition, whereby they can have specific physical features that we can look for. So we will do a physical examination, and then that will also follow, as you can see in my photo here. During my history taking with parents, usually I will allow the child to have some free play in my clinic area there. I will at the same time also observe how they play with the toys that is displayed. And my nurse will also try to engage the child in play, and I will be observing all of that, how he interact with my nurse, how he play with the toys, yeah. And a lot of times we can actually observe many features, yeah. And that will, again, after the free play, after I finish my history taking, I will engage with direct interaction with the child. Yeah. And a lot of times we also make use with standardized instrument, some standardized developmental assessment instrument to assess their development. And while doing that, I will also try to observe for any features of autism, if that is a suspicion. So as you can see, it's a very lengthy process. And a lot of time also, I will need further information, maybe from the kindergarten teachers, school teachers, or the therapists as well.
Okay. So it's a lengthy process. Got it.
Yes.
We are at 4:11, so we're gonna go through the next part very quickly. What are some interventions that you can share with us? I mean, what is that you can share with intervention that you know that can be done with kids with autism? Okay, what happened to the slide?
Okay. Can we show the slide as well?
Yeah. The device is not connected. If you could share first, and then we'll get the slides on while we're waiting.
Oh, okay, okay. All right. So just now the slide actually shows what some of the handwritten notes I wrote to the parents. So the intervention for autism is multidisciplinary.
Okay.
So usually the speech therapists are the professional dealing with communication. Okay, let me mention the professionals first. The speech therapists targeting on communication side of things. Occupational therapists, they have a very wide range of intervention, including social skills, self-help skills, sensory problem, emotional regulations. Yeah, and sometimes it will involve clinical psychologists as well, especially the older kids. Sometimes they have mood disorders like depression, anxiety. Then sometimes a lot of times we also involve child and adolescent psychiatrists. Usually for the teens and young adults, they will be managed by the child and adolescent psychiatrists. Sometimes there are medications that may help with some of the comorbid problem as well. Yeah, and so for intervention, I will usually share with parents. This is just an example what I share with one of the parents. Intervention can start immediately. Of course, there will be waiting times with whatever therapies you try to book, because these are the things parents can do. Play is very important. Parents have to spend time play with the kid. Play is the therapy. There are two types of play: interactive play or toy play. You need a variety of toys. Toys is your instrument to teach your child certain skills, yeah, social skill, communication skill, in expanding their language, in encouraging them to have social interaction, back and forth social interaction. And the other thing is parents have misconception. Therapy means I must send to a center and it has to be done by a therapist. Actually, I always tell parents the main therapist is you, parents, because you are the one who understand your child the best. You send to therapy, maybe it's just 1 hour a week or just few hours a week. However, you are the one who spend the most time with your child, and you know your child the best. All right, and you can do. And every daily routine is the teaching moments. Yeah, when you go to grocery shopping, when you bathe your child, meal time, sleep routine, bedtime routine. These are the teaching moments. So this is a very important concept I want to get through to parents. Yeah. So for example, if your child doesn't know how to body parts yet, during shower time, when you wash his hair, you can sing a song and tell him this is hair, this is the ear, this is the nose. You teach your child to play. Yeah. Exercise is very important. I think I encourage parents to bring the child to playground. I mean, ideally every day will be good, but if not, at least not as many times as you can, playground activities or some sort of exercise. Yeah. And I also encourage parents to read to their child. Bedtime story is very important. Regardless of your child's age, you can read to them. There are many books that is made relevant to your child's developmental age level. Yeah.
Okay. So basically, parents are the best therapists.
Correct.
Yeah. Okay. So these are the ones you mentioned, the professional.
Yeah, I think I mentioned the important ones. Yeah. This one, I think parents, if you're interested, these are the tips I shared how to choose intervention centers. If you're interested, you can go to my Facebook page or my website. Yeah, I think we can go to this one.
Okay, and lastly, this one.
So this is the last slide I want to share. So I think this is a book by Dr. Barry Present. It's called Uniquely Human. I encourage all of you to read this book. Doesn't matter, parents, educators, interventionists, therapists, and doctors, please read this book. Because I think we should move from this old paradigm to this new paradigm in order to help our autistic community. So the old paradigm is we see autism as a deficit, a set of deficits to be fixed. Yeah, but we should look it in another angle. It's a unique way of being human, and all of them has unique strengths, just like all of us. So we should be strength based. Yeah. And previously, our goal is we want to make this child and fix this child so that they appear quote unquote normal. Okay, I mean, how do you define normal? Yeah. So anyway, the new paradigm is that we want to help them reach their full potential at their own terms. Yeah. And thirdly, for intervention, usually previously we focus a lot on we want to control them, we want to change their behavior. A lot of this behavior, we say these are undesirable behavior, these are bad behavior, and we want to change them. But research has shown that a lot of this repetitive behavior or their fixation, there's a reason behind it. It's how they regulate their emotion, it's how they regulate their stress, how they calm themselves down. It looks like it's non-functional to us, but it's actually very functional to them. So with this understanding, I think we have to change the way we deal with this. Yeah. So we need to understand, first of all, what causes the behavior in the first place. Yeah. The function of the behavior. And lastly, we used to define success by how closely the child conforms to the typical development. I think we need to change our mindset. Success should be the child having a positive sense of self. They feel happy for who they are and they have the ability to thrive. I think this is the most important goal. This should be the final goal that we want for our kids. Yeah. It's not about fixing them to be like typical children. It's about them having a positive sense of self and they are happy.
Okay, fantastic. And your last slide is basically online resources, is it, that people can?
Yes, the first one is, this is a very good one by CDC. It's a developmental milestone tracking. You can track your child development. Actually, there's an app. You can download it for free on your app. It's called CDC Milestone. Yeah. The second one is if, say, you are suspecting you have some concern whether your child is autistic, you can go to this Autism Speak website where there is a 20 question. You just need to quickly answer 20 questions. This is a MCHAT, which is a modified checklist for autism intolerance. It's a screening test. After you answer all the questions, they will tell you mild, moderate, or high risk for autism. You print this out and book appointment with the nearest pediatrician near you, yeah, for further evaluation.
Wow, this is really important. And I've also put the Columbia team has also put your Facebook page here because Kui Yen Chong has asked to share, Dr. Annie, and you share stuff there as well, right?
Sure, I have shared a lot of things which I think is important for parents. Some tips, if you are interested, parents can check.
Okay, fantastic. That's another resource that you guys have as well. So I'm going to quickly wrap up this side of thing. One last question, Doc. If there's any one thing that the audience can take away from today's session, what would it be?
One thing only. Okay.
Yeah, one. Oh, you have two or three. Can quickly point form.
Okay, I think if you I think a lot of parents feel very overwhelmed with this. If say you're suspecting or your child has just been diagnosed, I think you need to acknowledge your own feelings, seek help, and please seek help from your family, from professionals. You are actually not alone in this. There are also a lot of very strong parents group, which I think is a good resource for parents to turn to. It's good to know that you are actually not alone. And that you might be overwhelmed with a lot of things to do for your child. Seek help, and also please break down all your tasks into smaller tasks. And if you can, you try to designate some of the tasks to other people so that you can relieve some of your burden.
Okay. I think that's a very important thing because sometimes we think we have to do everything ourselves. So seek help, and it's okay to seek help. Doesn't mean you're weak or anything. Yeah. Get support, kind of thing. It takes a village, right? Kind of thing. Okay, so fantastic. And with that, let's quickly go to the quiz section where I'll ask you the questions that can help you to win a neck pillow for today. And then we will go into the Q&A because we've already got 13 questions for Dr. Annie. Okay, so are you ready? All right, so it is now quiz time. And as mentioned in the earlier part of the show, there is some neck pillows up for grabs. But what do you need to do to win? First, you got to share this video out at least 3 times. Remember to set the share post to public so that everyone can see it, and answer the questions we'll be showing on the screen in a single comment, and you're on your way to win the prize. Let me repeat that. First, share this video out 3 times, and remember to set the post to public so that everyone can see. Secondly, answer the 3 questions we're going to show on the screen in a single comment, and we will select the first 3 winners based on the correct answers and shared posts. So are you ready? So these are the questions. Early detection and intervention are crucial for children with autism. Is it true or false? Parents play a crucial role in implementing intervention strategies at home for children with autism. True or false? There is a single therapy that suits all children with autism. Is it true or false? All right. So while we're waiting to hear who the winners are, the correct answers, while the team is on it, let's go to the Q&A. All right. First question is from Jessie Liu. Doc, can you explain more about autism spectrum? What is the spectrum based on? Very good question.
So, as we discussed earlier, the spectrum is actually when we make a diagnosis of autism, remember there are 2 area we look at. One is the difficulty in social communication, and secondly is there is this restricted repetitive behavior. Yeah, under restricted repetitive behavior, there are 4 components there, and for us to make a diagnosis, the child has to fulfill all the 3 components in the social communication domain, and at least 2 out of 4 criteria in the restricted repetitive behavior domain. So a lot of, once they fulfill all the criteria, in this is actually based on what we call the DSM-5 diagnostic criteria. DSM stands for Diagnostic and Statistical Manual of Mental Disorder. This is the reference doctors all over the world are referring to make autism diagnosis. So once we make this diagnosis of autism is not adequate, because a lot of individual we have this diagnosis, but you can see their level of functioning, their level of difficulties can be very variable. As I mentioned, we can have an autistic individual who is like an animal scientist professor like Temple Grandin. She's independent, she have a job, she actually designed some animal handling facilities. However, she's not interested to get married and have a family, but she's fine with that. Yeah. If you listen to how she speaks, right, actually there is some unusual quality in terms of her speech still. So this is one spectrum. Another spectrum will be an adult who is non-verbal, not able to communicate at all, and who is not able to take care of even his day-to-day routine. So this is another spectrum.
All right.
In between these 2 extremes, there are many people who fall in between. So there are many levels of different abilities and impairments. So this is why since 2013, we called it autism spectrum disorder. And based on how, as I mentioned, we will say is level 1, 2, or 3 to determine what level of severity. Yeah? Level 1 means need some support, but a little bit of support. Yeah. Level 2 means need substantial support. And level 3 means very substantial support. So which translate to mild, moderate, and severe. Yeah, I hope this answers your question.
Yeah. And Ainon's next question is how to differentiate between mild or severe autism. I think you answered that as well, right?
Yes. Usually we say level 1, 2, or 3. Yeah.
Okay. Got it. Ku Yen Chong has a question, Dr. Annie. Is there any effective cognitive training available for autistic children?
I need to clarify what does she mean by cognitive training.
By intervention.
I'm assuming maybe she want to increase the intellectual ability of the child. Maybe is that what she means?
I think maybe effective intervention, maybe. I hope maybe you can clarify us quick. But let's say it's effective intervention available for autistic children. There's quite a lot, right? And you can't just depend on one.
Okay, actually the intervention for autistic child, because each kid is very different. There's a saying, you see one autistic child, you see one autistic child. They can be very different in their profile. So that's why each each child, right, the intervention has to be tailor-made. There's no one size fit all approach. So my recommendation to parents is actually is not the same for all, because for example, I can have maybe a 9-year-old child. He's doing fairly. He's coping with mainstream education. He has no learning problem, right? However, his main difficulty is in the social interaction and communication. So for this child, I mean, the focus of intervention will be social skill group or social skill training. Yeah. And so whereas for very young children, maybe a 2-year-old who is non-verbal yet and who has a lot of sensory problem like hand flapping, excessive tiptoeing, and a lot of sensitivity to sounds. Yeah. So for children, for this kid who has a lot of sensory problem, usually we start off by focusing on occupational therapy first to address all the sensory issue first, because if we jump start to speech therapy, usually the outcome will not be very optimal, because the child will not be able to pay attention and in the speech therapy session. So we would say it's better to start with occupation therapy first to address all these sensory issues. Once the sensory problem improve and the child can pay attention better to other people, that's when we also add in the speech therapy. Yeah,
Okay.
so this narrates, so each kid will need a different approach in intervention depending on their profiles, yeah, of strengths and weaknesses.
Okay, got it. So, Doc, we've already got our winners. We are also at 4:30, but I think I'm going to take 3 more questions and then we'll go to announce the winners. So if you guys are okay, let me know in the comments. Overwhelming response. So can we continue, Doc? But very short answers, yeah? So one question from Jessie Liu is, can autism be managed until the autistic person becomes normal? I'm curious.
First of all, what do you mean by normal? I think, okay, again, I would like to stress that our goal is not to make them typical or normal. We want to help them when they have challenges in social communication. We want to help them to deal with that so that they can have the opportunity for their potential to reach their full potential, because sometimes these social communication challenges kind of it will hinder their progress in their true potential. Yeah. So so can autism be managed? And then okay, so I think that is not a correct goal that we should set, because first of all, what is normal? I also have a problem answering what is normal. Yeah. So it's to optimize their potential. Yeah. And based on their strength. However, when they have some challenges that have negative impact on their day-to-day functioning, maybe in school or at home or in the society, we help them address that by teaching them certain skills like social communication skills. Yeah. So the outcome for different kids are actually can be very variable. There are kids after a few years of intervention that can be mainstream. They can go to university, finish university, they can hold a job. Some will have family as well. Yeah. But there are also a group of children will continue to require support throughout their life. They probably will need special education, schooling, and maybe they will have to go to vocational school later on to learn some life skill. Yeah. Of course, there are also there's also a subset of individual who has to supported in by family or in a group home setting. So but early intervention is the key, because research has shown that the earlier we intervene, the outcome is better.
Okay, got it. So next question is from Ara Deva Harun. May I know what are the common misconceptions about autism? Maybe we heard a couple from you. What are some other misconceptions?
Okay, I think the top misconception is they have no feelings and they have no empathy. This is not right.
Okay.
Yeah, because they do, but just that they have difficulty recognizing and expressing it. Okay. The other one is vaccines cause autism. Unfortunately, there is this doctor who did a fraudulent study for his personal gain, and he claims the MMR vaccine caused autism. A lot of parents, unfortunately, until now, I still got parents who believe in it. We have done several very big scale studies, and it has shown no difference in autism incidence among the group that receive MMR and those who doesn't receive MMR. So we already proved that evidence is solid. So vaccine does not cause autism.
Okay.
I think another thing is autism means intellectual disability. Actually, not necessarily. Actually, previously we used to think more than half of autistic individuals have intellectual disability. However, the latest data actually is 70-30, meaning actually 70% has normal intellectual ability. Okay, I think if we understand this autism better and we gather more data, maybe the data may change again. But at the moment, the latest data has shown actually 30% of autistic individual has intellectual disability, whereas 70% has within intellectual disabilities within normal range.
Okay. Got it. So those are the misconceptions, yeah? One question from Veyros is, Doctor, I did come across virtual autism. Is that a medical condition?
Actually, this is the first time I come across this term. I'm not sure. Actually, I'm not sure what is virtual autism. Yeah, maybe you can share with us where do you come across this term?
Yeah. So Veyros, if you could share. Apart from that, while waiting, is there any is food also one of the interventions that we can do? Because I heard that allergies and stuff like that is quite prominent in children, and it helps when certain diet. I don't know. Does it help?
Yeah. Yeah, actually, a healthy, balanced diet, just like any other children. Yeah. A
Okay.
lot of parents ask me about some very specific type of diet, um, but up to now, we don't really have a very strong evidence that support this special diet actually helps children with autism. So this is not something that we recommend, because as a pediatrician, we only recommend what is evidence-based, something that have strong scientific evidence that of its efficacy. Yeah. So what we recommend is a balanced, healthy diet for your child.
Okay, got it. Balanced, healthy diet. Okay, that's fantastic. There is one question from Ainun, which I think is very interesting. Is there any potential long-term challenges that children with autism may face as they grow older?
Yes. Um, uh, there are some children, they actually responded very well to early intervention, as in they have speech, they become very verbal, they are mainstream in mainstream schooling. But usually the persistent difficulty will still be in the social communication part. Yeah. And I think we come across, we learn a lot from the videos and the discussion just now. Big theory of mind, the central coherent, yeah. And there's difficulty in reading others people non-verbal cues, yeah. So usually they still have persistent difficulty in social communication. Of course, the severity is can be variable depending on the individuals, but usually that is the main challenges, the social communication difficulties.
Okay, got it. I managed to get information from Vero. She would like to know about virtual autism if it's acknowledged as a medical diagnosis. So that is a question.
Not that I know of. Yeah.
Okay. All right. I think that sounds good. That is the end of our quiz. Wouldn't you guys like to know who? Q&A. Won't you guys like to know who our winners are? So before we announce, let's find out what is the correct answer. So the first question is, early detection and intervention are crucial for children with autism. True or false, Doc?
True.
Okay, awesome. Parents play a crucial role in implementing intervention strategies at home for children with autism. True or false?
Very true.
Okay, and there is one single therapy that suits all children with autism. Is it true or false?
No, false.
All right. So our winners are, thank you, Doc. The winners with the correct answer are Ara Deva Haran, Ella Joy, and Elvin Lam. Congratulations. I think all the gratitude messages and thank you from Elvin Lam paid off. He's one of our winners. So thank you so much for our winners. Congratulations. What's going to happen is that one of us will be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. I bet you'll be comfortable with your neck pillow. But for that, thank you so much, Doc, for all the time you have, because we kind of ran off a lot over time. But all of the information was very useful. There's a lot of feedback here, and you definitely got us understanding more about autism and accepting autism, I guess, is the way forward. Let us know in the comments how you are going to be starting to accept autism, what you're going to do, how you're going to play your role. But apart from that, thank you, Doc. This has been a really informative session.
Thank you, Nina.
Okay. Thank you so much, guys. Until next time, we hope you learned a lot. I certainly did. Do let us know what you intend to do, what action you're going to take from now on. Right? Thank you so much. And that's us from today. Thank you. Bye. Congratulations to our winners as well.
Bye-bye.